Hello, everyone, and welcome to this audio podcast in this series, the LabTronix series. This is a audio podcast on renal and lifestyle medicine. It's an RPSG and KDARS collaborative in line with the Storm Ballistix production, and hopefully today I'll be able to highlight a bit more about how a lifestyle medicine is in linked with aspects that have been sort of highlighted in one of at least one of the previous audio podcasts in this series as well. To begin with, I wanted to provide an overview and context of barriers to modifying modifying lifestyle. So some of the barriers can include thus. So there can be low health literacy levels. There can be a lack of quality context coming from a range of health professionals involved in aspects of healthcare. There can be conflicts with cultural norms. There can be issues where there's digital literacy and complicated sort of nutritional requirements that may be sort of more in line with sort of promotional material or context rather than actual information or actual educational aspects that can help patients. There can be sort of complications around that, and there can be issues in relating to implementing information in aspects of healthcare as well. So, for example, patients may receive information or educational aspects around, for example, lifestyle or lifestyle medicine, but there can be barriers in actually implementing aspects of lifestyle medicine, lifestyle aspects into practice. So in this regard, then I'm gonna highlight a little bit around adherence to healthy lifestyle. So adherence to healthy lifestyle to healthy lifestyle. It can begin with attitude, can begin with behaviours, but is therefore generally thought to be important to prevent the prevalence and incidence around chronic kidney disease. That being said, there's been little evaluations that has highlighted that has been evidenced in regards to the effects of lifestyle behaviours and changes surrounding prevention and the onset of chronic kidney disease in context in context, especially, for example, cross-sectional studies or longitudinal investigations as well. So, in context of aspects that align to lifestyle medicine and healthy lifestyle, for example, each 60-minute increase in, for example, weekly physical activity has been evidenced to be associated with an annual estimated glomerular filtration rate reduction of around 0.5% per year, and there's works by Mishishita and team from 2017 that sort of highlight this. High levels of physical activity and low levels of sitting time can be related to a lower prevalence of CKD. Aerobic physical activity can improve muscular function, cardiovascular function, walking flow, and also health-related quality of life. In context specifically to quality of life, CKD is associated or has been associated with increased risk of morbidity and mortality and severe impact of quality of life. And there's works by Cafale and team in 2019. Quality of life is an independent sort of risk factor for mortality in CKD patients, particularly those who are in approaching ESRD or end-stage renal disease. Low quality of life has been documented as major problems in the CKD population, and occurrence can adversely impact the course of the disease as well. In context of health-related quality of life versus, for example, quality of life, health-related quality of life, or HRQOL, focuses on the impact of health status on quality of life. End-stage renal disease, or those patients in end-stage renal disease, for example, tend to show lower health-related quality of life scores than compared to the general population. And low HRQOL scores in end-stage renal disease patients are related, have been aligned to medical and clinical compromises in context of socioeconomic status as well. And there's works by O and team from 2019 as well. And low health-related quality of life scores in end-stage renal disease patients are also associated with higher mortality and hospitalization rates as well. HRQOL is also affected by symptoms of CKD, side effects of treatment, and its burden. HRQOL has become important as many may have heard. For example, terminologies in related to person-centered medicine or person-centered medicine or patient-centric sort of medicine. For example, HRQOL has become sort of aligned to patient-centered sort of measurements, and is recognized as has been recognized as an indicator in context of healthcare and healthcare systems. The relationship or the association between low HRQOL scores and the adverse outcome is sort of less known, and especially less known in and around those who are going through CKD, and for example who are pre-dialysis or being worked up for a form of renal replacement therapy, but also in and around including including mortality and the cardiovascular outcome, and also CKD progression as well. Now, in context of this, there is some literature out there to highlight context in relating to lifestyle interventions. So preventing CKD progression is generally has been evidenced as of high priority for patients and clinicians, so thus to reduce the requirement for the requirement or the need for renal replacement therapy. Lifestyle interventions generally can be modified, and there's a literature out there to highlight that the lifestyle interventions in aligned to sort of behavioral medicine can help assess factors such as, for example, poor diet, low physical activity, etc., and the progression and aligned to the progression of chronic kidney disease and other life-threatening complications, and how those can be those can be investigated or explored to improve quality of life and prognosis of patients in and around the chronic in and around chronic kidney disease. Now, guidelines, some guidelines, and in particular the KDOK guidelines, highlight that health-related quality of life is again considered as an important outcome, and is a repeated sort of measurements. Repeated measurements are recommended to indicate quality of life care as well. So in especially those who are undergoing forms of renal replacement therapy. And again, there's works in context of the KDOK guideline and HRQOL. There's works that has been published by O et al. And team O et al. Or O and team in 2019 around this. Once again, I would like to acknowledge put a few acknowledgements out. So our colleague Olcha Kauska and also Christine as well. Thank you for taking the time to listen in on this audio podcast. Once again, this audio podcast was in linking with one of the sort of previous audio podcasts that aligned to, for example, physical activity, etc. And I hope this has been helpful. Thank you for tuning in on this audio podcast.